Now, just for a few moments, I would like to, I've invited the representatives of our church health team to come speak about some of the situation that we're in our community. So I've asked Betty Lane, and then Kathy Bailey's going to come and share with us, and we're going to have a microphone right here at the pulpit for you.
Thank you all for the opportunity. And for those of you who do not know me, my name is Betty Lane. I'm a nurse in the Lynchburg General Emergency Department. I'm a triage nurse at night shift. I go in at 11 p.m. and get off at 7 in the morning. You ask what a triage nurse does, you have to figure out who's your sickest patients and how to get them back to see a doctor quicker than the ones that are not as sick. Week before last, on Thursday night, I showed up at work and I was so overwhelmed I did not know which way to turn. I had a lot of sick patients and there was just one of me. I prayed to God that no one that was there would be harmed in any way or die in the waiting room because we were so busy. I went home that next morning totally exhausted and feeling like I just don't know if I can do this job anymore. I'm a little old for the job I'm doing. There's not many people that are 64 and still working in a busy emergency room. But I was off for 4 days and I was looking forward to recovering and being able to go back to work. And on my 4th day off, I received a note from one of my coworkers who said, "Betty, we are in such a desperate shape right now. Would you please come to work?" And I said, I was really enjoying being off, but I cannot leave my coworkers in that position or the patients who are waiting to be seen. So we had a huge number of patients. I went to work. We worked all night long and we got through the shift, but I was exhausted again. I normally work 4 days a week, so this past week I worked 5. Needless to say, I've slept for 24 hours to try to recover. I just want to tell you all what's going on at your local hospital here in Lynchburg. We are seeing children who are positive COVID. Children do not have a means to be vaccinated, and it is our responsibility to take care of our children and to keep them safe. I'm seeing pregnant women who are 6, 7, 8 months pregnant who come in very sick with COVID. We're seeing numerous patients that have no pre-existing health conditions. The most common age group this go around has been 18 to 50. Many of these people have never had a health condition in their lifetime. I have people saying to me at triage, I really regret not taking a vaccine. I really didn't think it was this bad. In one night recently, we had 3 deaths in our intensive care in one shift. It's a real thing, and I can't imagine what my critical care coworkers are going through at the hospital. We have had 3 deaths of children in the state of Virginia, 2 in Central Virginia and 1 this past week in Northern Virginia. The hospital staff is overwhelmed. We have hospital staff that are out with COVID, so we're more overwhelmed and more conditions. I just wanted to give you the laydown of the facts. I do honestly believe it is everybody's decision to make your own decision. I'm not up here to mandate anything. I'm just up here to say this is what we're seeing at Lynchburg General Hospital. 92% of those people admitted positive with COVID have not been vaccinated. 8% have been vaccinated. You can have COVID and have no symptoms, and you can give COVID to the person next to you. There's a lot of complications with COVID. It's not just at the time that you're in the hospital or you're suffering at home. COVID causes lung damage. There are many things in the future that can affect you. It causes blood clots. I had a 23-year-old come in that was from the first wave of COVID, and he had had COVID 3 months earlier. And he came in and he said, I don't know what's wrong with me, I just feel like I can't breathe. And he had a blood clot in his lungs. He had no pre-existing conditions and no risk factors for having a blood clot other than he had had COVID. I just want to end with this. I believe that God is the great physician. Don't ever mistake me for that. But I believe that God has trained people in healthcare and given people the ability to learn to help take care of other people. And those people in our community right now are really hurting. And I would just like for you all to know, the night that I posted on Facebook that I was asking for prayer, I felt those prayers every minute of the shift that I worked, and they got me through the shift, and I greatly appreciate that. And I wish you all would continue to say the prayers. In Matthew 22, the Pharisees asked Jesus, what is the first commandment of all? Jesus replied, you shall love the Lord your God with all your heart, with all your soul, and with all your mind. This is the first and great commandment. And the second is that you shall love your neighbor as yourself. I bring this report to you today because each one of you are my neighbor, and I love each one of you.
Betty has given us a very heartfelt description, I guess, of what's going on in the local emergency room, in the local hospitals, and how much COVID we're seeing in our community. What I would like to do is, first of all, give you an idea of what's going on in some of our local churches. Are we overreacting? Are we right on target with their church, with the precautions that we're going to put in place? One local church had to shut down most of their activities a couple of weeks ago because of a small outbreak. So it definitely is happening in churches and local churches. One local church, it's my understanding, had 2 members who died from COVID, and this hit them pretty hard. Fortunately, they didn't expose anyone in their church, but of course that church went on to put some preventive measures in place. It's my understanding also that one local church just this morning has had to go virtual because of a number of cases that occurred. And the last example that I'll give you is something that I saw yesterday. One of my former co-workers posted on Facebook asking for prayer requests for individuals who had concerns or issues with COVID. And one of the pretty immediate comments that was placed on there, and this wasn't in Virginia, it was in another state, but this person said that there were 25 families in their church who were affected with COVID, and not just one member, but multiple members in their family that had problems with COVID. So we believe our health team met Thursday with Pastor Chris and Rod, and we agreed that it is time to put some precautions in place. Now, obviously, one of those precautions is masking. You saw Betty and I both up here with masks on, and some of you have masks on as well. We strongly encourage you to wear masks when you're inside the church building. Both the unvaccinated and the vaccinated should wear masks. We're suggesting essentially to go back to what we were doing last year when we first came back together after the initial concerns with the pandemic. I'd also like for you to consider when you're working with their children. Betty mentioned children and not having the opportunity to have the vaccine, or for whatever reason have not had the vaccine. Those under 12 can. When you're working with their children in our church, be sure to wear a mask then, because you're their only protection. And as I was sitting here singing this morning, I thought I needed to say something about singing, because I'll be the first to admit that it's no fun to sing with a mask on. That's just not natural. However, And I'm not suggesting that our praise team get up here and lead us with masks on. I'm not suggesting that. There's distancing there and everything. But think about when you are sitting, maybe you're sitting with your family, but someone's sitting in front of you that could be elderly. You don't know whether they're immunocompromised or not. Think about what you do when you sing. You're taking that deep breath and you're making a joyful noise. So it's sort of equivalent to a cough or a sneeze with the amount of particles that get from your body out into the air. So for hopefully a short time, wear that mask when you're singing if you're willing. Another measure we'd like to put in place is social distancing. Again, going back to what we did when we first came back together last year. Try to sit 6 feet from people that are not within your own family, if that's at all possible. And also, in relation to the social distancing, take clues from the people around you. If someone does have on a mask, that shows that they're showing some concern for COVID and some respect for that virus. So if you're going to approach them to have a conversation, either keep your distance or put your mask on, or both, so that you're respecting that person's concern. If you're not really sure about a person's comfort level in a handshake, then do a fist bump. Don't hug unless you're really sure where that other person is coming from. So the social distancing is a very important thing. Think about creative ways to improve the ventilation wherever we are, whatever part of the church we're in. I think next week there's going to be some additions to our HVAC system, an air purifier that's going to keep our sanctuary cleaner, the air cleaner here. But let's say if you're in a Sunday school classroom, maybe open the windows if there are windows available to open. Think of what things you might do, meet outside if you can for certain activities, those kinds of things. And our church leadership has determined that we're going to continue the practice of not passing the offering plate or the Lord's Supper elements, certainly for the time being. And of course, it goes without saying, wash your hands or use the hand sanitizer frequently and thoroughly. I probably should have started with this one, but stay at home if you're sick and join us online. If you're sick with symptoms of COVID or any other infectious disease, it's important for you to stay at home. And also, if you have been diagnosed with COVID, obviously that's an important time to stay at home and to notify those that you've been in direct contact with that you do have COVID so that they can quarantine and watch for symptoms. And then Betty mentioned the vaccines. Again, my list is kind of out of order here. As a healthcare provider, I believe that with vaccine-preventable diseases, vaccine is our first line of defense. Now, we're going to have a time during the Sunday school hour next Sunday where we can talk about the efficacy of the vaccine and the safety of the vaccine, and hopefully answer any questions that you might have about that. And the last thing I want to leave you with is that when other countries who experienced the Delta variant before we did are considered, it looks like those cases spread very rapidly and then came to a peak pretty quickly, and then resolved themselves to a normal level of COVID. And I think that we're in the rising quickly phase of that right now. But if we can learn anything from those other countries, we can hope that our peak will come quickly, and that it'll take us a couple of months to get down to a normal level of COVID. I'm sorry that I have to say that. And then there's one model from UVA that tends to think that our peak will come in mid to late September. So hopefully there is an end in sight when I say all of these things. But if we do these things, it's our belief that we can continue to meet in person, hopefully, and that we can prevent illness and perhaps even death in some of our church members. Thank you.
Thank you, Kathy. And thank you, Betty, for sharing that. Just good information, just take into consideration. But I want to not just be distracted on some of these things. These things are important, but I don't want to be divided over these things. But I want to get back to what we need to focus on. Loving church, sharing the gospel, seeing lives changed.